Hi, I'm Rebecca Kleefisch from the 1848 Project. Eloise Anderson is most recently the Secretary of the Department of Children and Families in the state of Wisconsin. She is also an 1848 Project Advisory Board member and an outspoken advocate for the most vulnerable among us. And I sat down with her recently to get her dire predictions about the situation that our most vulnerable families will face post-COVID and the Wisconsin response. Here's what she had to say.
The government response to COVID has been to do lockdowns. And people who live in poor communities don't live in big houses. They live in small houses. If they live in a house that's small, 900 square feet, very seldom 1,200 square feet. If they live in an apartment, it's usually 600 square feet, maybe 800 square feet. And you have 4 or 5 people living in that space. And then they can't go anywhere. There's no activity for them to go to. They can't really go outside because we've said you stay in the house. We've created such fear in people. All of a sudden, people are confined together for long periods of time. The mental state just erodes. I worry about children and parents who are not really good at managing their temper. I worry about child welfare. I worry about child abuse, not necessarily intended, but because they're under such stress, the parents are under such stress, I think we have a lot more child abuse going on than we would normally have.
Talk to me a little bit about those children, because we know that they are right now, in many cases in these central city areas, not going to traditional face-to-face school.
Right.
How is that affecting them right now? How will that affect them long term?
Well, I think there are two things, emotionally and educationally. On the emotional side, if you live in a home where your parents have not figured out how to control their temper and their emotions, and tight quarters, then I think what these children are experiencing is a lot of emotional pressure on them. I think they're experiencing a lot of physical pressure on them because parents a lot of times will hit, do things that they wouldn't normally do if they weren't under a lot of pressure. The kids will not learn how to handle stress, so they'll be acting out because that's what they see their parents doing. So the learning issues that they're learning here are not really good. Academically, there's an assumption that every home has internet. That's a big assumption. So we say we're going to do online learning. Well, how do you know every kid has the ability to do online learning? And then it's not just inner city, but rural areas. A lot of places in rural areas, there is no online. So schools have made big assumptions about what's available for children. A lot of homes don't have reading material in the homes. So how do the children learn to read? The most important things that the kids need to learn, right, especially the little ones, by the time 4th grade hits, they should be reading. Because at 4th grade, they're now reading to learn. So if we lose kindergarten, 1st, 2nd, 3rd grade, we've lost the entry level to reading, the entry level to success. So I worry about that a lot. And I worry about parents' inabilities to cope and what that means for these parents as well. Because when you hurt your child and it wasn't intentional, you carry a lot of guilt. So the mental health issues here, which then push parents into substance abuse, not just overuse of alcohol, but they go to other drugs to find some peace.
In my old job, you taught me about ACEs. How many children across America, across Wisconsin, will wind up considering this period of time as a time when they acquired an ACE? And what is that?
It's an early childhood trauma. When I was working, I think we were shocked by how many kids had an adverse early experience. One, having a father who's in prison is an early adverse experience. A divorce is an early adverse experience. I know the middle class doesn't want to hear that, but divorce is an early adverse experience. A parent who's an alcoholic or a drug user is an early adverse experience. So a lot of things that we don't think about are really traumatic for the kid, and they push the kids in certain ways of thinking and emotions. So now we have COVID on top of this. So now we have a child who's already had trauma in their life. We're adding more trauma to their life. And to watch their parents try to deal with this, one, the parents have lost their jobs. The parents don't know where their next meal is coming from. The parents have no way of providing for their kids. It's kind of hard to say, well, government's going to take care of you when we have a government that can't respond, which is sort of upsetting. Oh, yes, I had a job so I can go get unemployment, but we've got, in Wisconsin, we've got families who haven't been able to get an unemployed check since March. So how are they supposed to deal? So what do they tell their kids? I can't feed you? You know, if you live in the country, at least you have the farm food. But if you live in the city, you don't have anything. So I really worry. I really worry about locking down the state without understanding what the lockdown meant.